good. But now I'm going to magically turn into Terry Dafter, because unfortunately Terry has been called to an urgent meeting about integration in Stockport. So I said that I would kind of step in and do his presentation. Now, I'm not as good at Terry's presentation because I've not done it before, so you'll have to bear with me. But I think Terry and I work very closely together, and we've done this presentation a number of times. So I'm hoping that I'm going to channel the Terry in me. As we're a little bit more northern, but we'll try. So the first thing Terry, I think, was going to say was, from the local authority perspective, it's really important that we see this as part of the wider programme. I guess that's the same point that I was making in terms of saying there's an awful lot going on. His point would be that from a local authority perspective, all of this stuff is hitting you at once. So, you know, in the department, we have our sort of policy team that do the Care Act and our policy team that does integration. But when it comes down to the locality level, all of that needs to, you need to make sense of all of that and work through what really is our strategy. So how do I think about managing demand from the Care Act that might come along from self-funders with citizen self-access to services and integration? So really, it's all got to be seen together. I think he would then start to talk about where we are now in terms of local government and where ADASS-IMG would like us to be in the future. So I think from the Department of Health perspective, we completely agree with all of this. So at the moment, we generally have systems that are designed with the provider and the commissioner in mind, not necessarily the citizen. We rely a lot on paper. I think we have a bit of... Oh, that doesn't look good. I'm not getting my own to touch it. It's Will here. Will technical Will too. Okay, I'll just keep talking. So it's paper. We all use paper a lot. Yeah. Fax machines. Probably still maybe one of the only areas that still use fax machines quite as much as anywhere else. I don't know. Maybe helping care services are keeping the fax supplies alive, but you know, there's a lot still in paper. How can we move towards a more digital approach, electronic records, etc. Things around culture. We've probably got quite a risk-averse culture to innovation and data sharing in particular. How do we change that? How do we make sure people not taking risks, but are more able to use technology to drive improvement and also to share information appropriately in the best interest of individuals. The traditional market model. We've got a small number of suppliers in terms of back office systems. How could we look to bring more innovation into that market? And that links into a lot of the work around open standards, open APIs, and different models that the Government Digital Service in particular are very keen on pushing. How do we get more apps? How do we basically catch up to a lot of the stuff that's happening in other industries and other sectors? We've seen recently in the news about Apple and the Facebook. All of these areas are really starting to move into the health space. Well, actually, that's great, but how do we also provide some assurance to people that this stuff is any good? So there's a big question that the National Information Board is looking about, do we need to accredit apps? Do we need to be able to, doctors need to be able to prescribe apps? Is this a new way of working? And the other thing is around how we use data more effectively, how we use the work that's going on across a number of the pioneer sites and other places on risk stratification. So how do we look at linking through the NHS number data together to be able to cross pathways and then be able to use resources most effectively within the system? Okay, now that's not working. It's going so well, isn't it? So ADASS-IMG have been working with our joint programme office, which is the Department of Health, the LGA and ADASS, on the overall implementation of the Care Act. And back in the spring we did a stock take of authorities to see basically where we were. And the 4 areas of concern that came up were workforce, communications, affordability and informatics. So So taking that on board, ADASS-IMG and DH basically started a programme of work, and Richard's here today. Richard wants to wave, so if you want to hear more about this, you can speak to Richard. A programme of work to work with the suppliers and local authorities on the case management systems and the changes that were required for 2015 and then beyond 2016. I'm pleased to say that as a result of that work, it looks like some of the risks for 2015 are manageable. We're not particularly concerned around the supplier side in being ready for the actual changes that are required for back office systems for 2015, although there may be some issues around deferred payments and individual local authorities, but generally the suppliers seem on board and ready. 2016 is a whole different kettle of fish. I think we know that. The consultation on the funding reform changes that would come in 2016-17 is due to come out later this year, and I think that will be the opportunity when we can really start to engage again with suppliers on actually what do these changes really mean. Because at the moment, whilst we're still sitting in DH churning through the policy, it's really difficult, obviously, for anyone to start thinking about what system to design when those parameters aren't set. I think the other thing that Terry would talk about would be the Care Act cross-cutting themes that all local authorities should really be starting to think about in terms of being ready for the Care Act in 15 and beyond. I won't go through this slide in detail, but the key areas are scale. So for some local authorities who have got a high proportion of publicly funded people in the system already, this may not be such an issue, but for those local authorities with high proportions of self-funders, the requirements around doing the assessments for the care cap are going to lead to increased demand. So there's a whole question there around, isn't this now the time to think about replacing manual systems with technology, investing in online systems, etc. National consistency, so the eligibility criteria, deferred payments. Again, is this an opportunity to look at how systems are operating and standardise them, because the suppliers will be able to do more standardised activities around this. The new functions, the first one in 2015 is deferred payments, but then later in 2016, thinking through what are those new functions, how is it best to manage those. And the other thing I'll pick out, and Bruce is going to talk about this later, but is around informatics skills and training for the workforce. So making sure that there's time planned in the implementation timetable to really spend some time looking at those and what's required for the workforce. I'm not going to go through that one. You'll be glad to know there's the final slide from me and Terry, and it's got Mr. Grave on there, which I do quite like. I think I might pinch for future presentations. But I think Terry's key message on this is, there's a lot of challenge at getting the system at the moment. There's a lot of change, but actually there's also some real opportunities around this. So I think the message is, where appropriate, start thinking about these things, about how you can essentially look at automating processes, using user portals, online access to help and care records, how we can look to join up services across the system, and also how we can look to put individuals in charge of their data. This is a really big theme for the department. Everybody will be aware of the care.data situation. I think that opens up some really big questions with opt-out about putting people in control of their data. So what we're going to learn from that and take forward into the future.